I'm Dr. Irene Papaconstadopoulos. I'm a pediatrician on Maui. I'm in private practice. And I've also worked as a hospitalist, both in the hospital here on Maui, but also in Europe. So I have some personal also experience with some of these vaccine preventable diseases. I just want to make sure that I can see the chat just to get an idea if someone would like to just put in the chat if they're in what specialty each one is, or if you're in what healthcare, industry you are, just so I know a little bit. You can just write in the chat. I think I can see it. So hospitalists, mostly please hospitalist. Okay, I'm guessing more pediatrics is going to be here. So first of all, I wanted to disclose that both Dr. Nishimoto and myself have received some funding from the American Academy of Pediatrics, the Hawaii chapter specifically for Vaccine Confidence Campaign. That's through the national, but other than that, no other relevant financial relationships or conflicts of interest. So we're hoping that after today, you're going to be able to take the first step to publicly fight misinformation or disinformation online, but also in your discussions with the families in person, that you'll feel more comfortable about facing some of what we hear online, and that you'll have a couple of tricks and tools basically that we've learned through this campaign and through some training that we've received to be able to communicate with families in a way that is very empathetic, that also builds closer, relationships with the families, and establishes a more trustworthy, relationship and long-term relationship with these families. But first of all, why would we as doctors need and want to do this? I mean, we've been trained so many years. Obviously, they should come to us for any, medical advice or any concerns they have. So let's take a look at what the scale of misinformation is right now. And this is actually from 2015. So at that point, from different polls online, and this is through Harvard actually, 91% of parents use the internet for medical information. I would say almost 100% today would go online to look up medical information. The majority social media, and about half encounter social media content regularly. And then a big range, 30 to almost 60%, report that the online health information they received influenced their decision for their child. So this is where the parents are getting their information right now and also making the medical decisions many times. Now, this also through Harvard, and this is the Civic Health Institutions Project, started in 2020. During COVID, we all know and we've seen in our practices that this misinformation, mostly loss of trust towards the medical community, became worse for multiple reasons that each person may think of. But what they did was basically go out to, they surveyed Americans from different states and asked this specific question: how much do you trust the following people and organizations to do the right thing during the current COVID-19 outbreak? And we see that in April 2020, in blue is hospitals and doctors, and then green is scientists. We were very high, so 70% would go to their doctor or the hospital and trust that they would make the right decision. And now back to 2025, bringing down to 25, that's dropped to less than 50% for doctors. And then, of course, pharmaceutical companies are at the lowest. So a really big decline during and after COVID. And the question they actually asked in 2022, after the lockdowns, was: how much do you trust the following people to do the right thing? Not specifically for COVID, but in general, which makes it even more important. So this does obviously affect patient care. And this is worldwide. So we see news in Australia and England, and many news reports that it's affecting child vaccination rates, that there is a crisis of trust in science in general, in medicine in general. And we know that this is probably not started just during COVID. This was before, and actually Sophocles was ancient Greek Athenian playwright who wrote many Greek tragedies, and he then said in 400 BC, what people believe prevails over the truth. So we always knew that many times beliefs will outweigh what is scientifically true. In 2013, and I actually read it then, Dr. Paul Offit, if anybody doesn't know him, he's head of, he's a pediatrician and director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He's also a pediatrician there in the infectious disease department and professor of vaccinology at UPenn. So this book in 2013 wrote about why would parents and patients turn to alternative medicine instead of following mainstream medicine, and the actual harm that he saw was being caused and the actual effect to patient care from alternative medicine promoted mostly by anywhere from movie stars to popular public persons. And this was before really the really big embracement of social media. And he starts this book with a story of Joey Hofbauer. This was a little boy in the 70s, was then 10 years old, was diagnosed in the 70s with Hodgkin lymphoma by his main doctor and an ENT that biopsied a lymph node. And although he was set up to follow mainstream treatment, which even then gave a very high, more than 90% chance of 5-year survival, the parents chose to follow alternative treatments. And it started this very, was on the news a lot at that time about the state actually filing a lawsuit against the parents and trying to sue them for, and through CPS, sue them for neglect. And the parents, I have to say, and rereading actually recently this book, and after seeing so many patients since those years myself, both in private practice and in the hospital, I remember thinking about it very differently. When I first read it, I agreed. I was mad at parents that would have done this. And now looking at it, I see that I'm not mad at the parents, and I agree that the case actually did not find them that they were neglecting their child. And I agree actually with that, because they were taking them to medical professionals. They were looking into options for their child. They were doing what they felt was best, and what they were hearing may be best for their child. So the child, unfortunately, a year later, and this is a paper in 1980, died after doing multiple different treatments, which were actually going through, they even started doing some studies on the treatments he received. But I say this because I feel that today that's a big part, that I don't think blaming the parents, and this is what the studies that I will show that parents or even the patients themselves, they always want the best for their child. And when you're having so much information come in, or even strong information from small sources like back in the 70s, that may give you just to grab onto a thread of hope that something could give a different treatment, it's really not so much their fault as much as the person giving the misinformation. And that's my personal opinion. So back then, getting this information would be maybe from some person you knew that went to this other treatment center, maybe from a friend that heard something. But today we get these alerts about different alternative treatments every day, literally in our pockets. So besides the amount of information that we get, true or not true, through our phones or tablets or computers all the time, studies have shown that misinformation actually spreads faster than the truth. And this was published in Science in 2018. They saw that false scientific information will travel farther, faster, and reach more people. It's 70% more likely to be shared, and it will spread 6 times faster online. And that was in 2018. Why? Something that is more emotionally engaging, that causes fear or surprise, you're more likely to share it. something that's novel that you hadn't heard that opinion. Maybe from all the doctors you've seen, you hear something different. You're more likely to share it, and it's more likely to be shared by humans. And this is the most important, and why, as doctors, we do have to speak up about this. It does cause real world harm. So we do know that parents decide to reduce vaccines based on what they've seen online. This is based on questionnaires that have been published. And it has been shown that during COVID, it did contribute to preventable illness and possibly some deaths. It can lead to harmful health behaviors, trying things that maybe have not been proven or actually cause true harm, and treatment avoidance. So it does affect us. But why would any of us prefer to read or even believe something that is not based on science? And this is where all of us should try to see the biases that we have when reading something. We know for parents that these are the top reasons. Confirmation bias is when we seek information that supports our existing fears. For example, I'm afraid that if I give this medication to my child, they will have a terrible allergic reaction to it. And I look about that online, and when I see something that says something like that, I continue to read that and say, yes, I found that I was afraid about. Omission bias is that something I don't do, for example, not vaccinating or not giving a medication, feels safer than actually doing something. The availability heuristic is that emotional stories generally will outweigh statistical data or scientific data or numbers. Rare side effects, we hear more about them now than the actual diseases. So it's the risk perception, they're hearing more about possible, even minor side effects. And then the illusion of causality, that because I got a rash today, it must have been that medication I took 2 weeks ago, although it could be unrelated events. But from all of these, what many studies tried to find out is which one is the most stronger one. And it seems to be the confirmation bias. This is the strongest driver. So parents seek out information that supports their existing concerns. And then, as we know, the algorithm will just feed more of that to them, more of the existing concerns. And these are some of the studies that have shown that. And people know this, so many times posts and stories that cause fear will actually be purposely put out because they know that that's going to get more of engagement. So what are some effective messages? And this is not just for vaccines. This is in general for health promotion, health information, science, really, promotion. So there was a randomized, and there are a couple of randomized controlled trials, and this was been published in Pediatrics in 2014. So this was a web-based nationally survey. So they had about 1,700 people, parents, all of them in the United States, who had at least one child, and they were randomly assigned to receive one of 4 interventions. So from these 4 interventions, I'll read through them. The first was they would receive information explaining the lack of evidence that MMR causes autism from the CDC, or textual information about the dangers of the diseases that may be prevented by MMR from the vaccine information statements, or images of children who had diseases prevented by MMR, or finally, a dramatic narrative about an infant who almost died of measles from the CDC, or there was a control group. So which one of these 4, and you can put in the chat, do you feel that was the most effective in making them change their mind about the vaccine? One person is saying 4, the dramatic narrative. Which one showed statistically significant difference? Let me see if I can see that. We're seeing 4 also. 4. 4. It seems like everybody 4. Okay, yes and no. So actually none were statistically significant. So even images and even dramatic stories about or not. Now in the study, if you read it, there was a slight increase difference with, yes, number 4. So a dramatic narrative, a story. but it was not statistically significant. So what does work, and what is mostly not to convince somebody, but what really will make somebody shift their mind and try to see what their doctor is really trying to explain. And what multiple studies, and there's newer ones than these, but these were the most in peer-reviewed journals that I could find. The first and most important is the trusted messengers. So parents respond better to people they already trust. It not just a pediatrician and a public health authority, but the actual people they know. And that effective messengers have been pediatricians, their family doctor, their nurses, local community leaders, or other parents, like a parent group. So those seem to be the most trust. And then how we communicate. So going back to the story that I described from that book by Dr. Paul Offit, and one common thing I see throughout all these stories and in my personal experience is that parents always say that alternative, I'll call advice, was always given with more empathy. They understood them, they listened to them. They were not judgmental about their decisions and their thoughts, and they were not confrontational. And so the studies show that we have to avoid any judgmental messaging, because as I said, I believe that it's not really the parents or the patient's fault. It's the messages, the messenger that's giving the false information. So acknowledging their fears and using simple language that shows empathy is always is a better way. And we know it's a little bit like we would talk to children when they're having almost a meltdown, that we want to say, okay, I understand your fears. I understand this really frustrating what you're going through now, because if we say, no, this is not correct, they're usually just going to stop listening. Narratives and stories. So our personal stories that we've seen as doctors, and showing the emotions that we felt when we saw these stories or that we heard of these stories. Then through, and Dr. Nishimoto is going to talk a little bit more about this, but a couple of tips for general communication that we received through some of the training we got, and I think will be helpful in everyday conversations. We also have we've made these out ready for many practices, and again, Dr. Nishimoto will go over these in more detail. But one more important thing that has been shown to work is to anchor your comments in the relationships you have with your patients. For example, when they ask you a question about something, and I use this every day actually in my practice, I say, well, this is a question I get a lot from parents. I get this question from other parents too, and this is what I tell them, to show them that, yeah, other people have these fears and I know about them and I talk about them all the time. Acknowledge parents' expertise. The one way I say it, at least, is that I cannot know your child in 10 to 15 minutes that I see you today. You know your child better than anyone. You are the expert for your child. All I can do is give you the scientific information and together make a decision. So bringing back that the parents are the ones that make decisions. The parents always want what's best for their child, and together we make decisions and help them find the correct information. And framing our expertise in ways that can help the parents make the decisions is similar with the second. That through my training and having seen so many kids, so many years, I have seen how this can turn out. Things like, so using our experience to help them make decisions, not so much that this is what the data says, this is what we have to do. So coming back to social media, all these studies that I showed up to now are really not ones in 2026, 2025, which I think has been an explosion of how much our patients and our parents use social media. So if you want to step out a little bit more into this area, some tips and easy ways to put like to do the first steps, unless you already are online, is to reshare others' content. So the American Academy of Pediatrics, AAP.org, and healthychildren.org have pediatricians and other specialties that have a very big online presence and do share evidence-based information, and just resharing that with your patients or with on your social media is an easy way to promote accurate information. And now Instagram actually allows sharing any story, even if you're not tagged in it. So you can just reshare something. And I just have an example of, this is a pediatric ER doctor, which has millions of followers and is endorsed by the AP and other organizations. Second, you can create your own content, and we keep it very simple. Use a very short 15 to 30 seconds video because the attention span for all of us is very short. So 30 seconds seems to be the max, although sometimes longer videos will keep them engaged. Using the tips we discussed before, and the easiest way is just to ask questions your patients ask you every day. And as pediatricians and as doctors, we're trained on this every single day. We answer hundreds of questions in just one day. This way we can answer that question. If one parent has it, probably thousands have it. But most importantly, patients want to hear your voice. It has been almost daily now that I have parents come to me and say, I heard that video you made about strep throat, and I think my child had that with that rash, or I actually had one that came in with the rash and it was. Or I shared that with another family that you had about feeding, and thank you for sharing all this information. I've even had patients say, I found you from your videos. And so this, is a way of showing you that parents do appreciate good online information. What I want to show with this is my personal Instagram and then my office's. And I want to show because I'm just one doctor and I have a very, very small following. This is not the millions that other people have. It's like, I think 2,000. But one post can reach 18,000 people. One post, for example, I had for the floods, made find 6,000 people. So I would never be able to reach so many people in my office in a couple of hours. So it doesn't have to be millions. This is actually impactful, and you will hear from your patients that thank you that you put that out because I trust you and I wanted to see what your opinion was about this. And then if you think this is just, people that aren't in Hawaii, actually your following can be based, if you put your location, will be people in your area. So this is basically Honolulu. And we've been using this also with the AP. And if others would like to share their information with the AP, we're open to review and share them also. Now, the one thing that a lot of people are afraid about, and I was in the beginning, is if you get negative comments. And this is something that I recently asked also Dr. Patel did a talk for the AP. And I asked specifically that because I did have in the beginning some very bad pushback from anti-vaccine groups that weren't even based in the US. But I'll say even in this worst scenario, what the people that came and supported me online and got them all down were actually the families that I see. So that shows that social media is truly social. So if you keep engaged, the families, the true friends you have in person are going to help you online. So if there are any actual threatening messages, obviously you have to delete and block them, and you can even report them now. If they're simply disagreeing or asking a question, you should leave it on, and that's the whole point of answering some questions, and others will chime in. But if you do decide, always this has to be with using the same framework we discussed before. And finally, one that is still active, and we do this, is write an op-ed or a letter to an editor, and still TV channels and editors want doctors and a pediatrician's opinion on things. And through the Hawaii AP chapter, we can help you distribute that too with your name. So I started out saying what was said 400 BC, what people believe prevails over the truth, but the same Greek tragedy playwright also said that the truth is always the strongest argument. And all of what I said, all the empathy that we put towards parents, it's always firmly based in the science. And that is a continuous that I have, that either way I try to reach parents where they are, I'm always staying in the scientific truth of what we're saying. And with that, I think Dr. Nishimoto will go over a little bit more of how the AP can help you enforce all of these.
Thank you, Irene. I am a pediatrician in private practice in Honolulu, and I've been working on the vaccine confidence grant with the AP Hawaii chapter. Just a little bit of background about the grant. So we did receive financial support from AP National for to help rebuild vaccine confidence in our population in Hawaii. And as a small chapter, this has really allowed us additional opportunities. We've been able to work with the AP National Communications team, their federal advocacy department. We've also gotten access to a national advertising firm, M. Harris and Kern. And the other opportunity it gave us was to work with Frameworks Institute, which is a nonprofit research organization that studies how people understand social issues and uses social science methods to develop evidence-based framing strategies to help with the best method for communicating with families that might be a little bit more hesitant about vaccines. So next slide. So moving on. So the objective of our campaign was to move the movable middle. So we knew that we didn't really need to address the people who are already strongly in favor of vaccines. We probably wouldn't be able to change the minds of the heavy anti-vax um, patients. But the people who are vaccine hesitant or who had questions about vaccines, that was really our target audience. We also wanted to make sure we could focus the resources where we could have the biggest impact, because this is a limited duration of our campaign. And going back to what Irene said, we wanted to make sure that we could regain trust in our families and to have pediatricians be seen as a provider of accurate information. And then we also wanted to build capacity. So we wanted to start something that could live beyond this campaign. Next slide. So locally, we have all seen this in our offices. We've seen this in the news as well too. So especially after COVID, our vaccination rates in Hawaii schools have really decreased. So among the K-12 population across the state, the total number of students or the total percentage of students who are considered up to date with vaccinations is about 80%. So we have about 20% that are not up to date. And this could be for various reasons. Some of them, like after the Lahaina fires, they lost access to care. Some of them, they just didn't turn in their school forms. Some of them, they chose not to vaccinate. And the next slide. And so looking across the island, so we do have, it's kind of widespread among all islands. There are definitely some places which have higher or lower vaccination rates than others. And then going through our campaign, we did initially try and target these audiences, but because our population here in Hawaii is so small, we realized that we really had to address kind of the entire state. So we did target families of the school age population, so those from the 0 to 8 years old age range. Next slide. And so as part of a campaign, we did realize that we needed to take a step back and we couldn't go straight into talking about vaccines with families. We wanted to regain the trust of families in Hawaii. And so as part of that, we did create a PSA, which I'll show now. I think you might have to share the sound, Irene. I think you might have to go to the Zoom settings to share it.
You can't hear it?
No.
Oh.
But if that doesn't work, then we can also link the YouTube link to it in the chat.
Yeah, I think I would have to stop sharing to share the link.
We
Do we have it here or?
I wonder if it works now because you're unmuted, whereas before you were muted, Irene.
Yeah.
I don't know.
On our islands, we know that health is not just about one child. It's about the whole ohana. As pediatricians, we become part of your medical history, responding to every illness and milestone.
We are part of this community. Our kids go to the same schools and play on the same teams.
We stand with you when your child is sick or injured.
If you have questions, we can help you make informed decisions about what is best for your family.
So as this PSA is currently being shown on 7 local TV stations, we also have it on our AP social media as well as our YouTube channels. And we really kind of wanted to dive right into this message of pediatricians as being our neighbors, being our patients and their families' partners in their healthcare. Because as a small community in Hawaii, we know everyone in our community, especially those in the more rural communities. And then so with we use this as a backbone for our campaign, and then extended this messaging for just general healthcare decisions as well as immunizations. Next slide. So we promoted our Facebook and Instagram content. And so in addition to these, so we started out with our messaging in October as a pediatricians as trusted partners, and then we progressed it to just other frequently asked questions that parents had about vaccines, such as ingredient safety, too many vaccines. We also tried to address topics that were vaccine related that were more prevalent in the communities at the time, such as influenza, pertussis. When there was the measles cases on Maui, we added messaging about that. And then there was a recent chickenpox outbreak on Kauai, we also added messaging about that. Next slide. And so with this, we were able to, as Irene showed with her own personal social media, we were able to extend the reach of the Hawaii AP. So we reached over 900,000 individuals. And this is relatively large considering our population in Hawaii is only 1.4 million. We also increased the number of engagements. So those were the individuals who liked our posts or who shared it with their friends. And also we increased the followers to increase the number of people that we could speak to just through our social media platforms. Next slide. And then, so going back, so I know all of us who are seeing patients in the office, we often get the question of, I came in today because I just was looking online and I didn't know what to do, or I got really scared when I went online. So we, through the help of healthychildren.org and the AP, so we do have on our website now, as well as our social media, this flyer that you can also share with your families as well too. So these are pediatricians who have been vetted by the American Academy of Pediatrics, who help share information about just general pediatrics topics in addition to vaccines. So if you're not comfortable or you're doing it online yourself, or if you just want to refer to patients to individuals who are already online that you can trust, then this is an excellent way to do so. Next slide. And then Irene showed the flyer about the messaging that you can use for your patients, but through the help of Harris and Kern, we also created sheets that you can post in your office or distribute in the community at events that you're at, to also share information and resources for your families as well too. So recently we did distribute these at community events such as the SPIN conference, and we're also going to be distributing it at the upcoming Keiki Rainbow Run this weekend. Next slide. So for those who are a little bit more old school, who go more online to websites, so we did update our HAP website to include more parent-friendly info. So we do have a lot of vaccine information on there now, with resources and links to the healthychildren.org, which is the American Academy of Pediatrics parent-facing website. We also have additional information for parents about other topics that our chapter advocates for, such as child and adolescent mental health, child development. So you can also refer patients there as well too. Next slide. And so when you're in your offices or when you're creating your content, we also wanted to provide educational opportunities for pediatricians. So a lot of us, or I guess I'm not even considered a younger pediatrician anymore, but many of us haven't seen a lot of these vaccine preventable illnesses. So having people like Dr. Marianne Mellish or Dr. Rodolfo Begay, who are peds infectious disease doctors, present information about some of the vaccine preventable illnesses were helpful. We also had a lunch and learn series with Dr. Alok Patel, who's a hospitalist at Stanford, and who also is a on-air commentator, and he also has a large social media presence. He gave us a talk about how to address vaccine misinformation and social media. And then we're also thankful that Dr. Maxim and Dr. Luca were able to have us on the pediatric echo sessions as well to also address various vaccine topics. And there is another one coming up with Dr. Mabuthia about pertussis as well too. So that should be very well received. Next slide.
Can we listen to
We
that?
need to talk about community
sorry.
immunity because it matters, especially when you're seeing headlines about over 150 unvaccinated kids being quarantined in South Carolina after a measles outbreak. We'll get back to them in a sec. Look at this picture. Look at this crowd. Imagine those in yellow are vaccinated against the measles. The ones in red have the measles, and the ones in white are not vaccinated. And measles is wild. It is one of the most contagious diseases we've ever seen. Just one person with the measles can spread it to up to 18 others who are vulnerable, like the white shirts. So the more yellow shirts, the better. They are a protective shield. It's like a group project. Everyone does their part. You all get an A. Less outbreaks. With measles, we want to see around 95% of the community vaccinated to prevent outbreaks. And those people with the white shirts, they're not just lazy who forgot to go to the doctor or anti-vax. There are also people who can't get the shot, like babies or those with immune system issues. They rely on everyone else, the yellow shirts, for protection. So now looking at the situation in South Carolina, when community immunity drops, a disease like the measles finds those gaps. And more people who are not protected get exposed and then have to quarantine to protect others. And that's not fun. You're missing work, school, life. Public health is a team sport. So keep those yellow shirts shining.
So in addition to just having our own messaging, we also did partner with community organizations as well, such as the Hawaii Department of Health, the Hawaii Children's Action Network, Hi-Fi, the Pediatric Echo Program, as well as the UH Pediatric Residency Program, and some of the community health centers. So we did partner and collaborate with them for different messaging campaigns that they had, such as the Department of Health's chickenpox campaign, and then I think the other one is HCAN as well too. Next, and then in addition to this, we will also be rolling out a campaign with the Hawaii Department of Health for their Vax to School campaign to address the kindergarten age population as well too. Next slide. So when you're making your own content or when you're just talking with patients in the office, some of the additional resources that you can use. So the American Academy of Pediatrics has excellent information. They also have infographics that you can use in your office. You can pull it up. It's in a digital format. The Children's Hospital of Philadelphia Vaccine Education Center, which Dr. Papaconstadopoulos referred to earlier with Dr. Paul Offit, has information as well to healthychildren.org is awesome for very parent-friendly information. Voices for Vaccines is a parent-facing organization that addresses more the societal importance of vaccinations. And then Frameworks Institute, which we also talked about briefly. Next slide. So next week is actually National Infant Immunization Week. So we will be rolling out some of our own content, but if anyone wants to take what we learned during this talk today and make your own content and tag us, we are happy to help promote it and extend your reach as well too. Or if you just want to share the information that we provide to your followers or to your friends and family, that would also help extend the information that is out there that will therefore be available for the families to view online as well too. Next slide. So this is our information. So we will, if anyone is attending the Hawaii Academy, the Hawaii AAP Timely Topics Conference next week, we will be making buttons that you can actually wear during your office visits with the QR code linking to the information that we shared. You can also refer patients as well as yourself to the chapter website. We're on Facebook, Instagram, and then our YouTube channel as well too. And the next slide. Any questions?
Thank you guys. That was amazing. So many resources, and I just dropped a message in the chat to remind everyone that in case you weren't able to click on every single link or scan every QR code, all of this will be on the iEcho platform available to you later on, so you can always go back and get it anytime that's convenient. I think they're kind of like refer to it multiple times type of resources that'll be really useful. One thing that I was wondering, maybe before we do the poll questions, is what do you do when you have parents who disagree like amongst themselves? Do you have any tips for handling that? Like if one is scared of, and wants to like hold off on all vaccines, and then the other one is wanting to follow the traditional schedule.
Should I go first? I think going back to that, the way the framework is that not placing like limitations that we're gonna legally you could say one guardian can make a decision, but personally in my practice I've never done that. I said, let's see what the concerns are from both sides and come to me with a decision that you've made together. And going through the frameworks and answering the questions that they want. I guess this depends on how insistent is one of the parents. But generally, I have found that approaching this way, and this is truly for the benefit of the patient. I know that even, and this is my personal opinion, I know that it is endorsed that pediatricians can choose not to see a patient that may not follow all the guidelines. Personally, and again, I emphasize this is my personal opinion, I feel that that child, that patient loses the opportunity to see a pediatrician. And that may make parents feel so bad that they may go completely against the medical community. I've seen that many times, and I feel if they stay and we're open to the discussion and we keep bringing them in and seeing what the concerns are, if they're in that middle that Dr. Nishimoto said was our initial focus, in that middle group that's just hesitant and has a lot of questions, it's very likely that we'll join the parents somewhere where we can find a good solution for the child. That's what I've seen at least.
I think similarly, so the ones that are on two different ends of the spectrum, those and very strongly opinionated about it, I think those are a little bit harder. But if there is a parent who is a little bit more hesitant or just having questions, providing the information to them, providing them resources that they can look at home as well too, and then having them come back is also very helpful.
Thank you. Folks, feel free to drop any other questions that you have in the chat. And maybe while we're waiting for questions, we could do the poll. I'll give you a couple minutes to answer these. maybe just a few more seconds and then we can close the poll. Kristyn or Irene, would you like to just go over the answers for us real quick?
Yeah, we can. So for question one, so according to recent trends in pediatric health communication, what source do parents consistently identify as the most trusted influence? So as Dr. Papaconstadopoulos shared, so the pediatrician or the child's primary care physician is still going to be the most trusted influence, despite a lot of parents or patients going to social media platforms. Number two, so when addressing parental vaccine hesitancy during a well-child visit, the most effective communication strategy is going to be your presumptive approach as well as the motivational interviewing. If concerns arises, we share that having a lot of technical information or mandates for your practice doesn't always help too much. For number three, when engaging with families, which of the following should healthcare providers be prepared to address? So all of these, and I'm sure all of us have heard those come up during visits as well too, and we have tried to target a lot of those with our messaging campaigns as well too. And then number four, according to the most recent school year data, what was approximate percentage of students who are considered up to date? So that would be 80%. So about 20% aren't considered up to date. And unfortunately, the 80% is below the 95% that is recommended for herd immunity for things like measles in our state. So we still have a little bit of work that we have to do here in Hawaii.
If I can add, that's one message I add to families that are many times asking, why are we concerned if we're unimmunized if everybody else is immunized? So the outbreaks that I remind them that we're in the middle of the Pacific. I moved here, I'm not from here, so that's always still something I'm not used to. And even when practicing, I always think about that do we have the resources if suddenly everybody got this, and then what resources are left for the other conditions that we continue to have, the transports we need. We know that right now, when we need to transport a child from Maui because we don't have an ICU in Maui, it may take up to 4 or 5 hours depending on the availability. What would that be if we had an outbreak? So then we're sort of concerned about, yes, even the vaccinated, if they have an acute appendicitis, if they have an accident. So that's one thing which many times they look at me like, oh, I didn't think of it that way. And then the presumptive approach comes back to what I was saying about staying in the truth and the science, that yes, we try to meet the parents halfway, but I always say that this is what they're due for today. Instead of asking, would you like to do this today? It's always that this is what I recommend. I'm steady on that, but I understand your fears and I respect them. So that approach is different and has been shown to keep parents trusting their doctor. Anything else? Any questions on all of these?
So on the inpatient side, we often come across under-vaccinated kids, even the ones that are vaccinated. So often they don't have flu or or COVID, especially. And, we often ask it as sort of like, would you like to get caught up? Do you want to talk to your pediatrician about it, in the sense of like trying to defer to that relationship that the families already have with their PCP? I always wonder if they just say they're going to talk to their pediatrician because then they don't have to do it right now, and then they can tell the pediatrician they thought about it and they don't want to do it. But I also don't want to kind of like, sort of overreach into that relationship. As PCPs, for either of you or anybody else who's on the call who's a PCP, what do you think? Should we be changing our way of talking about it on the inpatient side and saying like, oh, little so-and-so came in with RSV, but is overdue for a flu vaccine. Let's get that done before discharge, or what would you recommend?
I think the last that you said, that saying that, by the way, she's due today, she's due now still for these vaccines, and with this opportunity, you can get them done and protected today. And then, of course, if they want to ask their pediatrician, but having that statement that this is strongly recommended, and not so much asking, like, we recommend this, and then going from there.
Thank you.
Doing it at point of care is awesome, especially with some of the vaccines that are a little bit harder for us to get for patients in the community, sometimes, such as the COVID vaccine.
Mhm.
And then I think always referring patients back to their medical home is important, is helpful as well, to that they can that you'll let them know, their PCP know, that they did receive these vaccines, and they'll continue the series with them as well too.
Yeah. And also having this message at multiple points of contact, having the same message that, yes, they are due for this now and they're not protected. When they go to the urgent care, I see that a lot. When they go to the ER, when they go to, because if they go to all of these and they've never heard of it and they hear it only from their PCP, then they're saying, well, I've been to so many doctors, nobody told me. I haven't actually heard that, but having that multiple point of contact, and I think the urgent cares are also a big part that they could, they should be screening for it, so they could support this message.
Okay, well, Anna and I can bring that recommendation back to our group, and because I think we are a little hesitant about that, like kind of the relationship with the PCP, but there's 3 out of 3 of you saying no, please just go ahead and be a little bit stronger in your communication on that. And I think, I definitely know that sometimes I'm so busy and I forgot to ask, and I ask the nurse, and then I would say that the response rate is almost always 0 when the nurse goes in and says, hey, would you like the flu vaccine before you go? So it probably does matter if, how we're asking it, both from a nursing standpoint, but especially from our standpoint as the physicians too. Oh, really, Leanne? Maybe because we help them in their moment of like greatest need. That's possible. I don't know. I never thought about it. I definitely see a lot of trust of the outpatient pediatricians from our patients that we care for.
No, but I agree with that. I've heard that too, and I've heard people tell me, we like that you've had in a hospitalist experience, that you've actually, again, sharing the stories that you've, may have hospitalized and seen these conditions.
Yeah, and unfortunately, there's just going to be more and more of that. But we really appreciate the work that you guys have done to increase confidence in pediatricians, to increase confidence in vaccines. It's a Sisyphean battle, and you guys are really working so hard. And I've been part of meetings here and there with the advocacy committee to hear what you guys are doing. So I know how hard you are working and how much heart and soul you've put into this. So thank you for sharing everything you've learned with us. We're, happy to have so many people here listening now. We're happy to be able to share this on our Echo platform, and certainly would recommend to everyone to please follow the AAP social media and share these resources. So thank you guys very much. It's been really a great talk.